Today, I'm working with a patient who has a sacral wound with osteomyelitis due to MRSA. So I'm going to be showing how to properly don and doff PPE so that way we can work safely with our patient to protect ourselves as well as the rest of the hospital when we do leave that patient's room. So it is a contact precautions, whether it's direct or indirect. So there are two items that we need to prepare for seeing that patient. And the first one is going to be a gown as well as gloves. So the first thing you do is we're going to take the gown and from the front, we're going to put it on. So I'm going to show you how to do that right now. Sleeves go completely up and then we tie the straps from behind. From here and then on the bottom as well. Okay, so once that's on, we want to make sure we sanitize before we put on the gloves. So here, and when we do put on the gloves, we want to make sure that it goes over the sleeves of the gown just like that, so that we are completely protected. Here. Now, to properly doff PPE after seeing the patient, we want to make sure that we remove it before we leave the room. So the first thing we do is remove our gloves. So the way to properly do that is you're going to take two fingers and on the top, pull it, and then you want to roll it off of your hand, making sure not to contact your skin. You're going to grab it with the other part, and then from here, take your two fingers and go under the glove, and then slowly roll it, and after that, toss it away. And after that, you're going to go ahead and unhook the gown, and then as soon as you get this off, you want to make sure that you immediately wash your hands because it is a contact type of precaution. So you want to wash it for at least 20 seconds with soap and water so that way you can get rid of anything that you have accidentally touched. Okay. After the gown is removed, we want to make sure that we properly dispose of it. So we want to turn it inside out and roll it up and put it into the proper container so that way it can be taken care of and reduce the potential of spreading. So aside from the strict hand washing, because we're working with a patient with MRSA, which has contact precautions, we also want to make sure that we use equipment that's already assigned to the patient, whether it's a stethoscope or a gait belt. But if we do decide to use our own equipment, we want to make sure that we disinfect it with germicidal products so that way we clean it before working with other patients after that interaction. We also want to make sure to use patient education or to educate the patient about the potential of spreading MRSA because it is a contact type of disease, so it is able to live on surfaces. We want to make sure that we prevent that as much as possible.